The most dangerous drug in history wasn't sold on the dark web. It was aggressively pushed by your family doctor. Imagine a drug so powerful, it didn't just relieve pain. It did something far worse. It legally enslaved an entire nation, generating over $35 billion for a single, untouchable American family. This wasn't a cartel operating on the dark web. It was a tiny pill, approved by the government and aggressively pushed by your trusted family doctor. But the true horror isn't the body count it left behind. It's the classified psychological blueprint used to convince the world it was completely safe. Over the next 10 minutes, we are stripping away the gold-plated mask of the Sackler dynasty and Purdue Pharma. Welcome to the inner circle. To understand this empire, we have to look at its architects. Long before 1996, the Sackler family were not just wealthy, they were legendary billionaires, renowned medical researchers, and global philanthropists. Their names were engraved on the walls of prestigious institutions around the world. From the Metropolitan Museum of Art to Oxford University, at the center of their empire stood a private pharmaceutical company, Purdue Pharma. For decades, Purdue operated with prestige, stability, and extraordinary success. They focused on one goal: pain management, searching for what they called a medical holy grail, a powerful painkiller capable of lasting 12 full hours without triggering the intense cycles of dependency seen in traditional medicine. In 1996, they believed they had found it. They introduced a medical breakthrough called OxyContin. It was presented as a masterpiece of modern pharmaceutical innovation. But behind the scenes, something unexpected was happening. Deep inside the company's internal networks, a confidential memo circulated among top executives. It revealed a disturbing reality. The 12-hour formula was wearing off much earlier than claimed. In a significant percentage of patients, the core promise of the entire empire was quietly failing in real-world conditions. But instead of correcting the formula or informing regulators, Purdue Pharma made a decision that would define its legacy forever. The machine didn't slow down, it accelerated. Purdue launched one of the most aggressive pharmaceutical marketing campaigns in history. They deployed an army of highly trained sales representatives across the United States, armed with carefully designed studies and polished marketing materials. They convinced doctors that the drug's time-release mechanism made it safe for long-term use in chronic pain. From minor back pain to routine dental recovery, the prescriptions expanded rapidly. Sales bonuses for top representatives reached hundreds of thousands of dollars, and profits flowed directly into the private trusts of the dynasty. But outside the corporate towers, something alarming began to appear. Public health data started showing unusual spikes. Emergency room admissions rose sharply in small industrial towns, then spread wider. Then, investigators and journalists uncovered something the public was never meant to see. Internal communications revealed that executives were fully aware of the growing black market demand for their product. Long before regulators responded, you might expect the story to end with an immediate shutdown. But this is where the strategy became more sophisticated. Purdue Pharma didn't collapse. It adapted. They activated a powerful network of legal teams, public relations experts, and political lobbyists. Every time a community raised concern, the response was controlled, calculated, and effective. The narrative shifted, blaming individuals and misuse rather than the structure of the drug itself. Meanwhile, the company maintained its image of medical legitimacy, while vast amounts of money moved through complex financial channels beyond public reach. So the real question became, what was hidden in the blueprint? The answer came during a massive multi-state federal lawsuit. Unsealed documents revealed a disturbing truth. The company's financial success depended on maximizing prescriptions at the highest possible dosage levels. Their marketing strategy intentionally targeted regions with high levels of physical labor, exploiting chronic pain in working-class communities to drive long-term profit. It was a system designed to transform human suffering into sustained revenue, completely legal, deeply controversial, and devastating in scale. Eventually, the empire began to collapse, facing thousands of lawsuits worth billions. Purdue Pharma filed for bankruptcy. The company was dissolved and restructured into a public benefit entity. The Sackler family agreed to a massive global settlement and stepped away from direct control of the company. However, under the legal terms of the restructuring, they retained protection from many private civil lawsuits, and with it, a significant portion of their wealth remained untouched. Their names were removed from museums, universities, and cultural institutions across the world, leaving behind a legacy that is no longer written in marble or gold, but in something far heavier. But the story of Purdue Pharma may only be one chapter, because behind it, another dynasty has been whispered about. A global network tied to a chemical discovery in the 1970s, one that allegedly altered the trajectory of an entire generation, a secret buried for decades and still not fully understood. That story is where we go next. If you want to go deeper, beyond what is officially written, subscribe, turn on notifications, and step inside the inner circle.